should have free access to all that information. But if you want to do notes, let me know. And do you want to start with an app?
Yeah, sure. Thanks.
Sure.
Thank you for coming to the session. This is Safe at School, Protecting the Rights of Students with Diabetes, with Henry and Janet Rodriguez. There are some questionnaire cards on your table. There's a couple there. If not, we can get some more to you for review this session. If you have elementary or kiddie cove parent, your children must be picked up from the sessions. Teens and tweens are released on their own. Masks are not required throughout the conference, but if you feel more comfortable wearing one, feel free.
Okay. Thank you, sir. All right. For those of you just walking in, any of you that have attended sessions that Janet and I have done, either for better or for worse, I guess, probably appreciate the fact that we generally are fairly informal and kind of very interactive and back and forth. Because we're here wearing our American Diabetes Association hats, and because a lot of this content is legal jargon, I'm going to go through that in fairly explicit detail. The way we structured kind of this session and the session that follows the break at 11 o'clock is that I'm going to lay out all of the information. There's going to be likely time at the end, but there's also a session at 11 o'clock where we can look at specifics and kind of work with you, those of you that come back. There also is the opportunity to review, so if your partner or another family member wasn't able to come to this one because they were going to something else and they want a little review, we'll do that at 11 o'clock as well. Okay. So just in way of introduction, my name is Henry Rodriguez. I'm a pediatric endocrinologist. I am the clinical director of the Diabetes and Endocrinology Center at the University of South Florida. And Janet Rodriguez, my spouse, they all smile when I mention you, me not so much. But she is a registered nurse. She's a certified diabetes educator, and she coordinates our diabetes technology clinical and clinical research. So she's here to serve in whatever capacity, certainly to make sure that I don't say anything that I shouldn't be saying. So she's here to correct it.
That's not true. We're here because we're part of the Safe at School Committee, and we do, unfortunately, Crystal Woodward, who really is the lead person and usually presents this information, could not be here today. So we work very closely with her at all levels. So I know that he advocates at the congressional level. He's involved with important lawsuits and things that are happening for the advancement of rights and maintenance of rights for our kids and our adults. I'm in completely the other end of the spectrum where I work directly with school nurses and I train all the nurses in our area, and I serve as a resource for nurses, not just for our center, but anyone that I teach, I always remain available. And together, we worked on the new DMMP form, that's a national form, to help kids with technologies get better care. So we're involved at many levels, but really Crystal is the one that's the central piece, so I apologize she's not here. She wrote extensive and beautiful notes for us, so we feel like she's in the room because she provided her expertise. So anyway.
Okay. So Crystal, just to clarify, is the director of the Safe at School Working Group and the Safe at School program at the American Diabetes Association. I am co-chair of the Safe at School Working Group as volunteer, and Janet's a volunteer on that group. She was somewhat modest, and she kind of led with Crystal the development of the Diabetes Medical Management Plan that we'll discuss in just a moment. Okay. Questions? Anybody that just came in at the start? Okay, so for those, again, recap very briefly. For those of you that just came in, the way we've got this structured is I'm going to go through essentially a lot of the legal language that pertains to accommodations for children at school. There should be time at the end of this session. If not, we have an entire hour dedicated after the break at 11 o'clock where we can sit down and kind of go through particulars if you have specific questions as they pertain to your child or grandchild. Okay. All right. So, along the theme of legal, this is a requisite slide that the American Diabetes Association requested that we have in here. And I'm going to read it verbatim. While the American Diabetes Association attempts to ensure that all information is accurate and current, this general information about potential legal protections and medical best practices is not a substitute for individualized legal and other expert advice and assistance. The American Diabetes Association, its staff and volunteers, do not provide legal or medical advice or represent you. For detailed legal advice or representation, contact and consult an independent attorney, and for healthcare consultation and advice, consult with your professional healthcare provider. So that's kind of like the disclaimer that you hear at the end of the pharmaceutical ads on television, right? So, but necessary, I'm afraid. Okay, all right. So the mission of the American Diabetes Association is to prevent and cure diabetes and improve the lives of all people affected by diabetes. And that includes children and youth with diabetes and their families. We deliver our mission through three primary areas: research, information and support, and advocacy and public awareness. Today's program, we're focusing on advocacy, namely the Association's Safe at School program and campaign. Sure. Now you know why I have Jenna here. Sorry. No, that's okay. You know, typically with this kind of thing, I have a podium, but you know that's a little bit presumptuous. So, okay. So now I have to start at the beginning.
No, you don't.
Okay. So basically, you know, the mission here is to help you provide for your child and their diabetes care at school, and really the comfort of knowing that their diabetes is taken care of while they're at school. Okay, so Safe at School principles. Okay, Safe at School campaign is based on three principles regarding diabetes management in school. All school and staff members need to have a basic knowledge of diabetes and know who to contact for help. At a minimum, everyone who has custodial responsibility for your child should understand diabetes and know how to recognize a low and who to contact for help. The school nurse is the primary provider of diabetes care, but other school personnel must be trained to perform diabetes care tests with the school nurse when the school nurse isn't present. These tests include insulin and glucagon administration, blood glucose monitoring, carb counting, and recognition of treatment of highs and lows. If you look at the third is really this issue of students should be permitted to provide self-care whenever they're at school and school-related activities. Obviously, this applies to students who possess the maturity and responsibility to do so. So that's a conversation amongst you and the diabetes care provider and the school personnel. So that's really important. Okay, so the organizations listed on the slide agree with the Safe at School campaign goals and principles. These goals and principles help foster a safe environment for children with diabetes in school. And so they include the American Academy of Pediatrics, the American Association of Clinical Endocrinology, the American Association of Diabetes Care and Education Specialists, the American Diabetes Association, obviously, Academy of Nutrition and Dietetics, Children with Diabetes, Disability Rights Education and Defense Fund, the Juvenile Diabetes Research Foundation, the JDRF, the Pediatric Endocrine Society, the Pediatric Endocrinology Nursing Society, and the Endocrine Society. So, again, the issue here is we've gotten buy-in from really all of what we consider professional organizations that would have really a valuable input into managing kids at school that have diabetes. So, schools adhering to the Safe at School principles, we feel are best positioned to achieve these goals and to ensure the safety of your child while he or she is at school. As parents and guardians of children with diabetes, we know it's important for kids to have their diabetes management needs met to keep them safe and healthy in the classroom and all school-sponsored events and activities. So, if you look at three key goals for diabetes care within the school, the school must provide a medically safe environment for children. Children must have the same access to educational and school-related activities as their classmates that don't have diabetes. Schools and parents need to work together to support the gradual transition, and this is a key thing for me, gradual transition to independence of the student. As we all know, that diabetes is largely self-managed, and at this point, there's not a cure, and it's a chronic condition. So we want the student to gain increasing independence so that, when they go off to school or employment or have you, they've got all of their skills, responsibilities, competencies that they need to manage their diabetes well. If you look at one example of this, your child is deemed independent and managing their care, they should be allowed, if they're doing that at home, they should be allowed to check their blood glucose at school, preferably where they're at, so they don't have to travel to the nurse's office. It really is an effort to minimize the disruptions to their learning. But again, this is, and we're going to get to this in a lot more detail, this is something that needs to be discussed, documented, and adhered to when you're working with the school. And believe me, I'm going to come back to this again and again. This is a collaboration. And the school staff ideally is part of the team, right? Your children during the school year, hopefully after COVID, they're spending a lot of time in school, right? So you do want a supportive and safe environment. And in order to do so, in order to ensure that, it's working very collaboratively and very closely with the school staff. And I'm not telling you all anything I think that you don't already know, but it's important to emphasize that. So again, these are basic principles. I'm gonna see if I can use, now I'm trying to do two things at once. Okay, so as parents and guardians of children with diabetes, we know that diabetes requires 24/7 management, and children can't really take a break at this point, in all honesty. Parents and guardians should work with your child's school to ensure smooth coordination of diabetes management between home and school. For example, again, if your child self-manages at home, it's a reasonable expectation that they will self-manage at school. However, recognize that home and school settings vary. So if you look at, for instance, if your child is on a pump continuous glucose monitor, you might use your CGM and make adjustments very, very frequently. Again, this is where a discussion, setting expectations with the school as to what's reasonable. You may be acting on something every 5 minutes. It's not reasonable, in my opinion, to expect that a school nurse is going to do the same thing. So if a pump site goes bad, you may replace it right away, hopefully, right? With caveats with regards to rejections and so forth. But at school, the school may decide that, this is outside our purview, we're not really skilled and experienced in replacing sites, so backup plans, have that in place. They're going to go to injections, or, ideally. Or if you're close by and you can come in and replace, great, that's all. But all of these things need to be discussed and worked out ahead of time. And so, from what I consider, there are responsibilities all the way around, right? There are things that we expect and should be provided by the school, and then there are things that parents need to provide for the school. And so that includes making sure that they've got all of their supplies, right? So testing supplies, backup supplies, snacks and so forth, and then working out with the school, making sure they're in the right place where your child is, not halfway across the school, that kind of thing. And then, we all know that fluctuating out-of-range blood sugars can negatively affect their behavior and their learning. So students with diabetes may require accommodations to address this, such as extended time for homework and class assignments. And I'm going to go into fair detail as to what that involves. Parents should make sure that their care plans include, and we're going to go into this in a lot of detail, the 504 plan and their diabetes medical management plan, and they're developed before the school year begins. And so, for instance, at our center, we started this in May, where we were distributing diabetes medical management plans, encouraging families to complete their section. We'll go into this in more detail as well. And getting them back to us so that we have enough time to complete them and send them back, right? Unfortunately, I think many pediatric diabetes centers encounter a situation where, in some cases, it's, so here in Florida, school begins, or believe it or not, early to mid-August. And so end of July, beginning of August, there's that tsunami of requests for these care plans. And, you know, it's selfish in my regard as a provider, but, you know, that's a lot. So we really do try and encourage folks, even at the end of the prior school year, to kind of meet with folks, kind of set the groundwork, and be able to prepare all that documentation so that, and this may be a surprise to some of you, but sometimes we'll get a call on that first day of school saying, we have Sally here in the office. She can't be here at school because we don't have this plan. So it's really, really important.
Can I add also that when that happens, when we miss our opportunity during a visit and an encounter, we miss the subtlety, you know, when we have hundreds of forms in front of us, we're just filling in doses. But what we really want to do is hear from you that I cut back, or I have to give this much snack, or I use a temporary basal when they're active. They go low very quickly. We want a really good plan from day one, and that requires a conversation with you. So it's nice to do it now, so if you have a provider visit coming up, to make sure that you have the school form with you so that it's as individualized as we can make it. As good of a plan as we can make it for your child, given what we know.
And in follow-up to that, and we're going to get into this in a lot of detail, that diabetes medical management plan is step one. Right? Then there are subsequent plans that we'll talk about that you develop with the school personnel and input from various individuals at school to say, okay, well, this is the medical management piece. How does that impact their learning and their attending at different classes and the excuses, and all of that follows through. And one of those things is the 504 plan that I'll talk about in a few moments. But again, that's the first kind of critical piece, and then everything is downstream from that. And so it's important that, as Janet indicated, we get ahead of the ball on that one and try to really have the best plan possible at the start of the school year so that everything moves smoothly. Okay. So, what does your child need at school to manage his or her diabetes? Oh, you know, I typically do this at the beginning of sessions in general, but how many of you, it's your first time here? And this is the first you're hearing about this? Dang. Okay. Can I edit that out when I said it? No. So this is really, really important. How many of you have not done any of this at all today?
School forms.
Okay. All right. So most of you have had a pretty good run at least once, right, through this. How many of you feel that it went well? Okay. Thank you. How many of you feel that maybe not so much? Okay. All right. So again, the purpose here is to kind of go through the nitty-gritty and the details as to what your rights are and how to really progress through this process and make sure everything goes smoothly. So, your child, what they need at school. Timely access to a school nurse and trained school staff, obviously very important. Trained staff to recognize and treat highs and lows. Again, excuse the vernacular, but kind of a no-brainer. School-based emotional support psychological services as needed. I mean, it's, you know, particularly when kids get into middle school and high school, there's stereotypically a lot of drama. You know, diabetes just kind of adds potentially to that. So it's really important that, you know, you think about with the school how to address your child's diabetes and how it might impact them in general. Proper physical distancing measures and virtual learning. I think all of us, unfortunately, have gained a lot of experience in that over the last 2 to 3 years. Self-management permitted for capable students. Right? It shouldn't be dogmatic that, you know, Johnny, who's 17, has to go to the school nurse to check their blood sugar. Well, he's wearing a CGM and he's done this forever, you know, that kind of thing. So it's really important that you have those expectations set. Full and safe participation in all school-sponsored activities. Incredibly important. Access to accurate carbohydrate and nutrition information. Access to all supplies, equipment, and medication with food included in it. Okay. So again, this is a basic list, but then so much more stems from that. Okay. So back to school strategies, right? Recommendations. approach, and I said this before, but I guess I can't personally emphasize this enough. Approach the school staff in the spirit of cooperation, right? The old adage that, but it's better to track ants with honey versus, what's the other thing? I don't know. Somebody help me out here. Vinegar. Yeah, we'll go with that. Yeah. So, it's this issue of that fine line, and again, I think most of you at this point have negotiated that, of this is what my child needs. And legally, you need to do that. But, it's that realization that you're really asking them to partner with you. And believe me, I've had instances where school nurses, which are phenomenal by the way, and they don't get enough credit, have stepped forward and they said, you know what, I'm going to follow your child's CGM. And in some cases, parents have gotten a call on a weekend because their nurse has had their, and in fact, I remember one parent telling me, I figured if it was a parent or grandparent, that, the school nurse confessed that, I kind of look at things over the weekend just to see, and when they come in on Monday, they'll get a call saying, it seems that, Sally's had a little bit of a rough time this past weekend. What can we do? And so forth. So it's really kind of enlisting their support, making it collaborative and that kind of thing. And whether you choose to send them cookies or what have you periodically, not the child, but just the nurse, you may want to do that, right? So collaborative, really, really important.
Can I add something here?
Yes.
So we see, unfortunately, we have a high turnover at schools. We have a high turnover of school nurses. It's an extremely difficult position to be in and a very difficult job. Their responsibilities are huge. So we really go to great lengths to bring them up to speed, to provide real-time support to them, because some of them don't have experience with diabetes. And in other circumstances, you may have someone that's cared for 20, 30, they might have 4 in the same school. So that's something that we really watch out for carefully. I start people on devices. So that's my first question to the parent. Is there anyone else at school? Who else at school has diabetes? And that informs me, do I need to reach out, or is there's 7 other kids with pumps? So I think even with principals, they don't even know that these things are not optional, really. We don't want to beat them over the head when we find out that they're new and they're really uninformed. That's why the Safe at School and having it all on the website, all of these resources, I send it out all the time when I have people contacting me from the YMCA. What exactly are we required to do? What are the laws? Having an organization documenting this, having all of the major diabetes organizations writing standards about what's expected, all of this together comes together to give us the resources that we need to educate our new principals and to set the standards so that they understand that these things are all agreed upon and in writing and official. It's not me personally asking you to do this. This is the expectation by law, and we'll get into those details.
So perfect segue, which in my next comment, which is it's this issue of really perspectives, right? And considering these things, right? We're only human, and again, I think most of you that have had children in school have encountered at least one instance where things didn't go exactly right. So having all that understanding that, oh, by the way, that nurse that has perhaps 20 kids with diabetes in the school also has, 20 kids with asthma and, 10 kids with ADHD, and they come in and they need their medication and things like that. So that understanding, we want children to be safe at school, whether, have diabetes or something else. But so there are those accommodations, but then there's that really coming to terms with the fact that, you're there as a mom or a dad 24/7, and you're doing everything every moment. That school nurse and the personnel there, A, has other responsibilities, and B, may not have really the level of training and sophistication managing diabetes that you do. So that's really, really important. So in line with that it's, really communication early and often. So with school personnel who will be in direct contact with your child, that means bus drivers and coaches and whoever really has contact with your child, making sure that they're aware. And it's a fine line, particularly as you get into middle school and high school. You don't want that coach saying, Sally, right in front of everybody on the field, right? You have diabetes and you have, no, it's not that, right? It's coming up with reasonable expectations. You don't want that coach, which believe me, I've heard. I had a coach tell me, I didn't know Johnny had diabetes, right? And, we're getting together for a scrimmage, and where's Johnny? Well, Johnny had wandered off the field, and it turned out he was low. The coach had no idea, and were it not for one of the other students, wouldn't have known. So we don't want that scenario at all. And so all of what we're doing is really in preparation to try and avoid that, right? We talked a little bit about, again, you are your child's, grandchild's, what have you, best advocate, right? So, really taking that role and making the most of it. And part of that, as I talked about earlier, is providing everything that they need, right? So you don't want, if your child is having a low, for them all, to scramble. Well, let's get to the lunchroom. Let's see if we can get some juice or what have you. That's where, you can really provide all of those resources. And frequent communication, making sure that all that stuff that you provided at the beginning of the year, they didn't go through all the juices and now there's none left. So having that communication with the school nurse or whoever the designated person is really, really important. And then, one thing that we probably, at least at our center, don't do enough of is really making sure that they've got their medical identification. Yes?
You mentioned school buses.
Yes.
We had a 504 set up, and it made it sound like the school buses didn't need to follow the 504 because they were a different company. Is that the case?
It depends on the state, it depends on the school district, and sometimes even the school. So again, that's an issue where, you try to come in, and again, we're going to go through a lot of this, but you come in fully informed as to what your child's rights are, and you present it to them. And if they have, for instance, they contract with a company and they don't feel comfortable, you need to make this through. I was going to get to this at the end, but there was a suit against the public school district in the city of New York. If I'm not mistaken, largest school district in the country, right? State law in New York says that the only person that can administer insulin in the school is a registered nurse, right? That sounds a little bit unreasonable. So what does that mean? In order to comply with these legal requirements, they need to have a school nurse on a field trip. They need to have a school nurse on the bus, and they've accommodated that a little bit. But it's these kinds of things that you need to be aware of because, they might say, well, there's not a school nurse that's available. Well, the law says that the only person that can administer insulin is a registered nurse, and my child may need insulin in this situation. They're on a school trip, they're going to have lunch. What are you going to say? The child with diabetes, you can't have lunch because there's nobody to give you insulin. That's just not right. So, yeah. And I'm sorry, you guys came in a little late. I'm not, faulting you for that, but we've got another hour session after the break where we're going to go over any particulars that we may not have covered. Okay? All right, so I'm not scolding you in any way. All right. So, again, it's this idea of be realistic. Particularly as kids get older, I'm not saying you go to the extreme, which some of our patients, I think, a little bit extreme, they have a tattoo, right? I personally think that, God willing, we're going to have a cure, and, getting that tattoo off in the future is going to be a little challenging.
Look at a life through it.
Yeah, exactly. No, circle in the line. But this issue of, despite your best efforts, right, they may be in a situation where there isn't anybody close by that knows they have diabetes and has gone through this. So worst case scenario, if they have to call 911, the EMTs are going to come, and if they've got a medical alert identification that says they have diabetes and they're unconscious, it's not going to be, oh, well, this may be, God forbid, a drug overdose or who knows what. they have diabetes, the first thing they're going to do is address a possible low blood sugar, right? Now, there are all sorts of circumstances. So if your child plays soccer, yeah, they probably, or another sport, they don't want a necklace on them, right? Because that could be potentially. So coming up with, whether it's on their shoelace or what have you, that, the EMTs are trained to look.
And in their
certain places.
phones. You can put it in your phone as well.
Right. Now, wouldn't apply to the
The
soccer
emergency.
field, but
But most
yeah.
kids have phones with them, so that's important too.
You think teenagers have their phones with them most of the time?
No.
Everything. Shower, everything. Okay, so cooperation, be realistic and reasonable. Communication, again, this is an ongoing theme. From your perspective, provide those supplies. Updated contact information, right? Part of the DMMP and everything that follows after that is between you and the healthcare provider, hey, these are the circumstances during which I want to be called. A blood sugar of 70 has some juice, you don't have to call. But God forbid they have ketones and they're vomiting or what have you, you come up with a plan and then it's your responsibility to provide them that information. Either it's you or somebody you designate that they have. If I can't reach, mom, I can reach dad. If I can't, or the other way around, dads, you're not off the hook. So, having that available to them is critically important. And I mentioned the IV tag.
On our new form, we even added the child's information. They all have phones. So we even have the child's phone number and photograph so that they have a face shot of the child on the DMMP as well if they're going to a huge school.
And there are a number of school nurses, and you may want to suggest this, where, depending on the age of the child, a younger child is not going to have the same degree of autonomy and responsibility. So, if they're going from gym to music class to whatever, a number of school nurses will come up with kind of a cheat sheet. Has the child's picture at the top, even if it's a substitute. And just basic information, maybe that they have diabetes, first of all, right? Maybe brief, if they're doing their symptoms of highs and lows, that kind of thing. So that it empowers that person to really help your child, right? If a situation arises. So that's really important.
One of our neighboring school districts, which was one of the largest ones, I found out during one of my talks to the school nurses that when you were saying that your child was independent, they didn't require any documentation. I was like, are you serious? Like you don't even know who is coming to you every day that has type 1 or type 2? I said, that's crazy. So under independence, or under the levels of independence, we describe what that means. And when you're independent, it means that you will, as a school, provide support when that child, the expectation is that they will receive support when that child needs support. Obviously, they're not completely independent during, at all circumstances. We want you to know exactly, have all of the orders that you need to assist the child when the child that's independent needs assistance.
So, yeah, I mean, you don't want the situation, and I'm taking it to the extreme, right? So, again, does anybody have a child named Johnny, by the way? Okay, all right. I always feel bad, I have to ask. Okay, so Johnny's 17. Johnny's on a pump, he's on a sensor, he is good to go, right? If, God forbid, Johnny has a low and he passes out, you can't expect that he's going to give himself glucagon, right? So, again, these things, there's, and the form which we'll go into in a moment and we can discuss later in the session this afternoon is, later this morning, sorry, that, it's this level of support for that student. And again, this is all very individualized, and quite honestly, as kids grow and mature, even sometimes within the school year, those responsibilities may change. And, not to, again, I always throw teenagers under the bus, but Johnny, who's 17, and again, no Johnnies, used to do all of it on his own. But you know what? Now he has a girlfriend, and his priorities change. And all of a sudden, everything that he used to do without skipping a beat, it's not a priority anymore, so he doesn't do it anymore. So I think the communication piece, and maybe something that maybe you don't see at home, but the school nurse or whoever's in charge of taking care of their diabetes is noticing, he's not checking, or he's not coming in for his insulin, or what have you, or he's coming in with a high blood sugar, and and that kind of thing. So that communication is really, really important. So that, unfortunately, sometimes we run into a scenario where I haven't seen a patient for 3 months, their last A1C was 6.8, and they come in today and it's 9.7 or 11. 3 months later, because they've fallen off the wagon. Right? And these things happen. Everybody's human, and I think any of you, and full disclosure, we've got 2 young adult children, 26 and almost 24. They don't have diabetes, but you know, they go through that period where, you know, perhaps they were the most responsible child, and then the hormones and all of that stuff, it becomes a little more challenging. Or maybe you've got, you know, a toddler that becomes a little more obstinate, so to speak. Really, really important. So this is where I'm going to go into some of the legal terms, and they are confusing. There's lots of references. There's even some overlap in terms of terminology, but it's really, really important. And so knowing your relevant federal and state laws that provide legal protections for students with diabetes places legal obligations on the school. And they have to, under certain circumstances, legally provide some of these things. And as Jen has mentioned, this is not the kind of thing that you go in with an attorney at your side and you beat them over the head and say, you know, you have to do this, you have to do that. But it's coming together and saying, listen, we want to do what's appropriate to keep my child safe and to make sure that they can learn and really benefit from all of what other kids that don't have diabetes benefit from at school. So, there were federal laws and some state laws that provide protections, right? So, very much encourage that you go to ADA's website to learn more, and there's lots of nuances, and I'm going to have several references in here. But, you know, understanding those laws and how they work and how you can use them to really ensure that your child is well taken care of is very, very important. And so, if you just go to diabetes.org, which is the main landing page for the ADA, and it's /Safe at School. And then there are numerous links after that. So, again, I'm going to go into these in perhaps exhaustive detail, and just to complicate things, I've been talking about the ADA. What's the ADA? Oh, it's the American Diabetes Association. Oh, well, it also happens to be the Americans with Disabilities Act, right? So, then there's Section 504 of the Rehabilitation Act of 1973, right? And I'm going to explain exactly what that is. It's referred to as Section 504. The Individuals with Disabilities in Education Act, or IDEA, those are federal laws, and then there are state laws, regulations, and guidelines. And so being aware of those, and in particular, in your state, in your county, at your school, is really, really important. And again, there's a section, diabetes.org /Fed laws, that specifically talk about federal laws. Okay, so it's important to remember, students with diabetes have legal rights that don't go away during a pandemic. So, I think most school districts are at the point now, I mean, nobody wants to think back at this, but when everything shut down and every kid was remote, they still have rights. So, for instance, a number of teachers track how much time that child was face-to-face on their computer at home. And a child with diabetes may have a low. They have to step away, they have to take care of it, or high, or what have you. And so, these things did not go away. And so, you know, God willing, we won't go back to that particular environment, but if we do, just kind of keeping this material in mind, right? So, again, the idea is by federal law, students with diabetes can't be excluded from school-sponsored activities because of their diabetes, okay? And it's been quite a number of years, and I'm hoping it doesn't happen currently, but I remember having a young teenage lady who was diagnosed with type 1 diabetes, and the parent came into the next appointment and said, well, the school said that now that she has diabetes, unless I go with her, she can't go on any field trips. That doesn't fly, right? So being aware of that is really, really important. You know, time and time again, we've got general recommendations, but it's all individualized, right? So, which is why being proactive, trying to set things up ahead of time is really, really important, because you want to make sure that what's documented at the school is not just some, you know, kind of default form that they use for every child with diabetes, because we all know that they're all different. So that's really, really important. Okay, so here's a summary of the federal legal protections for children with diabetes, right? So Section 504, it pertains to public and private schools, including religious schools that receive federal funds and have legal obligations to provide diabetes care under Section 504. So particularly any school that receives federal funding, even if it's for a school lunch or breakfast plan or what have you, they are subject to these requirements. So under the law, diabetes is a disability, okay? Now, I will tell you that at our center, and me personally, we work so hard to empower these kids to view their diabetes as, hey, I have diabetes, but I don't like the term personally, and I know people with diabetes use it amongst themselves. I don't like the term diabetic, right? You are a child, you are a person with diabetes. And so we work very hard to not portray or instill in them that diabetes is a disability, right? They can do just about everything with the proper care. But legally, folks work very hard to have diabetes classified as a disability because it brings all of these things into play and provides for protections and rights. So, and the way the law is set up, and there's strict definitions, right? So it's a disability that limits a number of major life activities, such as walking, talking, eating, and endocrine function. This is the legal language, okay? And the major life activity that is substantially limited does not need to be learning. Right? So none of your children are mentally disabled, right? It's their diabetes that has an impact on potentially their learning environment at school. So it needs to be addressed. Students who qualify for services under Section 504 should work with the school to develop a 504 plan. And again, we're going to go into this a bit more. Again, ADA, in this case, the American with Disabilities Act, not the American Diabetes Association. It applies the same way as Section 504, but it also applies to daycares, camps, and recreation programs. Okay, so 504, schools. ADA, everything else that receives federal funding, okay? Written accommodations plans should be put in place for students and children who are eligible for services under the Americans with Disabilities Act. And then IDEA, the Individual with Disabilities Education Act, that's a specific law pertaining to education, okay? Under IDEA, it must be demonstrated that diabetes or another disability adversely impacts a student's ability to learn and make academic progress. Again, excuse the vernacular, that's a no-brainer, right? If you have low or high, that's going to impact your attendance at class and your ability to learn and so forth. So, if diabetes doesn't adversely or significantly impact your child's ability to learn, your child may qualify for the IEP or Individual Education Plan. So again, a number of nuances here, and one thing that I'm going to get to in a moment is that there are legal responsibilities for the school to meet with you, with the appropriate personnel to work through all of this. It's not that you have to go out and get a law degree to figure this out. They're under obligation to be able to help you with that, okay? So, state laws and regulations. While all schools must comply with federal law, the laws that we just discussed, there are state law considerations, right? So states have nurse practice acts and other laws and regulations that speak to who may or may not provide care to students with diabetes. And I mentioned the situation in New York, where it has to be an RN. To add to the confusion, some policies and practices differ within school districts. Some states have developed school diabetes management guidelines of their own. And again, this is where the American Diabetes Association, checking their websites, there are even state-specific guidelines there. So that's helpful. If you live in a state where the schools only allow a school nurse to provide diabetes care, then a school nurse must be available at all times, not just part-time.
So mentioning that, does that mean that the child who is 17, who is taking responsibility for their diabetes, are no longer allowed to take care of it in school because it's labeled as an RN has to take care of it?
So the short answer to that is it should not. You want it in writing, but so, if the child is able to independently manage their diabetes, again, we are strongly advocating that they be allowed to do so, right? And getting that in writing, I think, is really, really important, okay? Because the last thing you want to impose upon a very responsible, competent 17-year-old is, oh, by the way, I know you're wearing a hybrid closed-loop system, that your blood sugar is in good control and so forth, but before lunch you need to stop in at the nurse's office so that he or she can check your blood sugar before you go to lunch. You know, that's, I think, unreasonable. But working within, you know, local policies, I think, is really, really important.
So through a lot of advocacy and a lot of work, and every year we come back and we do a lot of education, have we been able to kind of keep the momentum and set the standard higher and more in writing? And just a couple of years ago, they were telling us, we don't do sensors, you know? So this is a really important part of advocating for our kids. And it's really a continued effort to educate them about what's needed, about what's appropriate care, and what the rights that the kids have in wearing the devices that they need to keep good control and to stay out of the nurse's office as much as possible so that they're participating.
Can I ask a quick question? You said something about if a state requires only a nurse, or if a school requires only a nurse, does that go to private schools too?
If, in terms of the legal implications, if they have any federal funding at that school, they're subject to this.
Yeah, because the reason I ask is we're getting a lot of pushback for using the devices, and the nurse isn't always available. And you said they have to be. If they require that the nurse has to do it, they have to be available. What was the word, the expression you used?
Lord knows. But it has to be available during school hours and at any school-sponsored activities.
Okay.
And again, yes, ma'am.
One quick question. How do you find out if a private school gets federal funding?
You asked them.
I did ask them, and they said that they'll check with their lawyer.
Yeah.
Why is it that I haven't heard?
Wow, that doesn't really set up,
State Department on.
you know, that.
Go to their Department of Elementary Education on for that state.
And you-
That says who gets what.
Did everyone hear that? That's important. Can you please repeat that so that we...
Well, in Missouri, as a retired special education administrator, like,
Thank you for being here.
well, thank you for doing this, because it needs to be done, but, in Missouri, and I believe because it's federal, if you go to your state's Department of Elementary and Secondary Education website, there will be probably more links than you have time to deal with, but there will be federal links, and you just go there, and it should list who it is. If at a minimum, it'll have who's in charge of federal funds, and there'll be a line you can call to that State Department to find out.
And as I said, the ADA website does have some state-specific information. They try to keep it as up-to-date as possible. And I believe there's also links to specific. Or quite honestly, call the school, say you want to speak to administration. And I mean, it's not like they can withhold that information.
Right.
We've actually had a 5-4 meeting with the principal, and whenever I've asked, because they've been very accommodating in many, many ways, but the one thing that they are requiring parents to go to field trips to monitor,
Yep.
you know, which right now is fine when he's going, you know, to the nature center. But in a few years when they're going to DC and they're going all the other trips, he's not going to want mom to tag along. So I wanted to find out, like,
And it's not fine. It's nice that you can do that. Most parents can't do that. They can't take a day off. So that's depriving them of an experience that everyone else has, so that's something that they really can't do.
Yeah,
If-
that's the one thing that I wanted to find out about, because they're saying they can't send a nurse. Wouldn't like
Well,
some-
they need to make sure that somebody else that's qualified to assist your child in managing diabetes is there. Again, if it's a school-sponsored event, right? So there are ways potentially, and I'm not trying to sound like schools are nefarious in this regard, that they're trying to find a way out of this, but if it's not a school-sponsored event, then these things don't apply.
And if they don't get federal funding, then they're not.
Right.
But they also try to push it back. Like they don't always know, right? I would tell you this, and they don't know. I'm in New York.
That's why you should know.
Right, I'm in New York, it's not their fault. They don't do it all the time. There's not a lot of diabetics all the time.
Yes.
My daughter there's 3 kids in the whole school district, and the others didn't know any of the stuff, and we had to find it out and bring it to the people. So you unfortunately have to do the work.
You have to do the work and
Don't
use
accept
the
no.
website.
Right.
The Safe at School describes everything in writing in a way that they can understand that's official. Use that ADA Safe at School website. It has all kinds of links that you can share with after-school programs, with schools, with preschools. It really describes the rights of our kids with diabetes. So it's a great site, and thank you for mentioning the fact that we have new people all the time and they just don't know. And if we are always partnering with our families and they call upon us to say, we want help, we need to educate this principal, we need to get the rights that we need, and we have a social worker that really specializes and understands this well. So ask for help also from your medical team.
Make them don't be adversarial. Adversarial is the worst thing you can do. And they're there. It's a tough job. Whenever you get there, that makes it worse. And you have to bring it back and be their friend and help them understand it. And that's hard. My wife's like a pit bull. So it's like, you gotta.
You know that this is being recorded, right?
Your wife is going to be able to see this.
Yeah.
No,
That's all right.
No, but again, it's, and I thank you for bringing that up again. It's, if you think about it, there are school nurses that really are there, by and large, the vast majority, to help your child in whatever way they can. Unfortunately, sometimes it's legislators in Albany or in other state capitals where, you know, they're budget crunch time, they're trying to figure out what to do. Oh, we'll snip this and snip that without a full realization. So it's, again, sometimes working with your school nurse saying, listen, I'm not allowed to do this. So it may mean you're going to, your school board meeting and saying, hey, this is an issue. And this is where all of you are really tremendous resources, not only and advocates for your child, but for that next kid that goes to school. Maybe your child is the first kid that's gone to school with diabetes. Yes?
My daughter went to private school in high school when she was diagnosed, and we came with the 504 plan, and they said, we don't accept those. And then we made an appointment, and they said, but we'll go line by line.
Yeah.
We can probably accommodate almost everyone. Because I was nice about it, they were like, yeah, she can have water on her desk. Of course she can have a snack with her. And one by one, a few things that they didn't want to allow, which was letting her finger prick at lunch, we fought for it, and we got it. Because they just didn't understand why it was important. I don't want her to go to the nurse and be with sick kids, sits out her lunch, or she's, I'd rather not be sick. So they allowed it, but we were nice about it, and they made accommodations even though they weren't required to by law, because they don't get federal funds.
So thank you. And the take-home theme here is, again, it's that fine line. Just because you're nice doesn't mean that you can let them do whatever they want, which is not in your child's best interest, right? So it's working together with them to meet your child's needs in a reasonable, collaborative fashion. And I think that's really the take-home message. I'm going to stop you for just a second. We are at a little less than 10 before the hour. I am on slide 14 of 34. I warned you. So, not that I'm strong-arming any of you, but feel free to come back. I'd like to cover some of this other stuff at 11 o'clock. Yeah, Jen.
Yes, go ahead, please. Go to the next slide.
Now I've lost your enthusiasm. Okay, so state laws, really important to be aware of those as well. Okay, so written plans. This is where we get into the nitty-gritty of the differences, right? So 2 types of written plans that you should be aware of. One is the Diabetes Medical Management Plan, okay? That's what we refer to as the doctor's orders, right? That lays out specifically from a medical standpoint what needs to happen at school to allow your child to benefit from all the educational opportunities that any other child that doesn't have diabetes has access to, okay? So that's the first thing. Then there's, as we mentioned, the Section 504 plan or an other written accommodations plan that really speaks to the education piece of it. Students who are eligible for services under the Individual for Diabetes Education Act, or IDEA, will have an individualized education plan known as an IEP. So I've thrown out ADA, American Disabilities Act, American Diabetes Association, the IDEP, the IEP. There's a lot here, right? So this is why we have these sessions here, really, because there's a lot to go through and a lot to be aware of. But they're really, I think, critically important. Believe me, early on in my careers, I speak to parents and they're like, well, we've got this great school nurse, and we don't need any of these documentation because she's in our corner. She's doing what she needs to do. But, you know, what if there's a substitute school nurse, or they move someplace else, or administration changes at school? And so that's where I personally have come to the philosophy that, you know, it's better to have all of this written down and be aware of the legalities of this. Not that it's creating an adversarial situation between you and the school, but that everybody's on the same page and has realistic expectations. Okay? And we'll stop wherever we need to stop, and you know, during the break, Janet and I are here to answer any questions. As I said, we're going to be here at 11 o'clock as well, right? So these are 5 plans, that schools commonly use to document and support delivery of care, as it's prescribed by the student's healthcare team through what document? The DMMP, or Diabetes Medical Management Plan. That's where things start. That's you and your child's healthcare provider coming together and saying these simple things. These are their insulin doses. These are their symptoms when they're high and low. This is what you do when they're high and low. This is my contact information. All of that information is there, and that's really a starting point, okay? So that's what needs to be done to manage a particular student's diabetes, okay? It's written by the healthcare team, input from the student, right? So if you've got a teenager, they should be part of that process, that discussion. Yeah, I'm able to do this. And then the parent comes through and it's like, well, no, you're not wearing your CGM like you should be. And so it's that discussion of, yeah, Johnny would like to be fully independent, but you know, he really hasn't been. He's been distracted. And so getting the school nurse or the school personnel to kind of partner in, kind of helping them along and achieving that independence that we want for all of our children and young adults with diabetes. Yes?
So on our DMMP, we found that the school was following that very strictly. So we had the doctor put in there. However, if the mother finds something that is better, the mother has reigning authority, or the parent has reigning authority, because that DMMP is not always going to be exactly what the child needs at the time, but the parent knows what they need.
I'm going to preface this comment with, I'm sort of kidding, they let you get away with that?
Yeah.
Yeah. So that is permissible in some schools and not at all in others. There are school nurses that DMMP is the rule of God. And they can't do, even though it may be reasonable, they can't do anything that deviates from that. And so that's where, yes, sir.
I just have a follow-up question to that too. Our DMMP, our endo, basically in every line has said like, it depends. It depends. Yeah, as needed. How do you put that kind of way?
In my particular situation, they're a glutton for punishment, because that means that if Johnny comes in with ketones and that hasn't been specifically addressed in that DMMP, that school nurse can't do anything until they call my office, and either me or one of my partners then faxes an order that says that they can do X or Y because it hasn't been documented in the DMMP. Now, how much time do we have left? Like 5? 2. Okay, thank you. Okay, so she's not in the room now, so I can say this. Janet spent countless hours working with Crystal at ADA, Karen Harriman, who is a former school nurse and worked at the Barbara Davis Center in Colorado, who's my co-chair on the working group, and getting input from Michigan, New York, Virginia, California, trying to get buy-in from school nurses, trying to get buy-in from diabetes care providers to come up with what we consider to be the best DMMP. Okay? It is available on the ADA website. I personally am asking all parents to go there. There's a link. I will apologize. I know this is being recorded, but I'll apologize anyway. The first thing that you get is a pop-up box by the ADA that says, would you donate? Okay? So apologies for that. You don't have to do that. But then there is a description about the Diabetes Medical Management Plan, and there is a link to a fillable PDF, which basically says you get the link, you get a PDF. there are instructions, and again, for the sake of time and realizing that you all maybe can't come back at 11 o'clock, there on the top right-hand corner, there are instructions that say parent sections and other sections. And I will tell you that it's great because it incorporates pumps, CGM, hybrid closed-loop systems. It's 6 pages long. It's dense, right? But it tries to address all of these issues with the newer technologies. And the other really valuable piece of it is page 4 specifically deals with dosing. Kids that are on, hopefully not too many in my opinion, but straight dosing, they do 5 units at lunch and they need this many grams of carb. There's a lot of flexibility in that to accommodate a child's particular diabetes regimen, or insulin regimen, I should say. The important thing is we've designed the form so that if your child's insulin regimen changes in the middle of the year, you don't need to fill out all 6 pages. All you need to do is fill out page 4. But again, it's a fillable PDF. We're encouraging people, families, to fill out their part, and then preferably by email, send it to your provider. They can complete the PDF, send it to you in the school, and it's all typewritten. I have to pity the school nurse that had to read my handwriting in the past. I get the call, what does this say? So much so that we kept copies so that when they said, what did they say, I could go back and say, assuming I could read my own handwriting, this is what it was. I very much appreciate all of your attention. This is exceedingly important. I encourage you to come back at 11 o'clock. If you can't and you have specific questions, I don't know where Janet ran off to, but I'm sure she'll be back. Feel free to corner us in the hallway, preferably not the bathroom, but please, thank you. Yes, we'll be back here at 11 o'clock.
How do we get to the PowerPoint?
It should be on the CWD website.